Hi, I'm Dr. Sumalatha, Consultant Physical Medicine and Rehabilitation at Aster CMI Hospital, Bangalore. I'm talking on World Day for Safety and Health at Work. Safety and health at work forms the fundamental right of any person who is working. This is celebrated on 28th of April every year. When we think about safety, so the first thing that comes to anyone's mind is when we hear of news in the newspaper where a construction building under construction has collapsed and so many got injured. So mishaps can happen, but how do we make the workplace a safer place for any worker is what we have to learn from this and form policies and execute. So being at healthcare, so I'll be talking on what are the hazards or what are the safety measures or things can happen at workplace. So being at the healthcare industry, so I'll be talking where the staff working in healthcare are exposed to multiple types of hazards. For example, or to categorize, it can be physical hazard, it can be chemical, or it can be ergonomic or psychological hazard. Physical hazards can be of multiple types, say as simple as an uneven floor or a wet floor where people can trip or slip and fall and injure oneself. It can be patient or it can be the staff also. It can also be something like a falling object which is there unnoticed, and it can injure the neck or the back of any patient or the staff. It can also be the exposed electrical wiring where they are at risk of having electrical injuries. Chemical hazards, when we think about that, like at hospitals we have many fluids or the body fluids or the patient care related, where in direct contact they can come or they can inhale the fumes in the lab or chemicals which can be there, that can lead to any type of injury. There can also be something called ergonomic hazards. So we must have heard what is ergonomics. That is the workplace, how we maintain our body posture, or how what type of lighting is there, or the noise level. So this all comes under the ergonomics. So how can ergonomics be there in the healthcare is what we will think. But there are people who are working from 9 to 5 in front of the desktop or laptops. There are people who are assisting patients as soon as they enter on the wheelchair, or there are staff treating the patients on the bedside who are bed-bound patients, or even the radiologists who are sitting long hours in front of the ultrasound machine in the bad posture, conducting so many diagnostic tests or the interventions. Even the surgeons standing on the OT table who are bent and working for long hours on the OT table are also at risk of having ergonomic hazards. So when we talk about ergonomic hazards, what leads to these ergonomic hazards? It's basically the poor posture, working for long hours in the poor posture, or frequently lifting heavy weights or putting so much pressure during the workplace, and working in inadequate lights or working at excessive noisy areas, having inadequate rest in between the stressful work hours, or work pressure stress itself can lead to the ergonomic hazards. How can ergonomic hazards be prevented? By oneself and by efforts from the organization. When we talk about oneself, like how can they take care of themselves, it's by maintaining proper posture. Or when you are working for long hours, take adequate breaks in between. Having a good sleep cycle. So having a good physical habit like working out or physical activity on a day-to-day basis, having good eating habits. All these are the ways that one can take care of themselves, or seeking help immediately when they notice any pain or aches. So how can organization help in these things? Is by conducting regular training sessions for the staff related to what ergonomic injuries can be and what they have to do when it is done, and also by maintaining the equipments and all the equipments that are involved in the patient care, by maintaining a regular checklist so that no mishaps happen. So other than the physical, chemical, ergonomic, there can also be psychological issues which can affect the staff. Like how can psychological issues be there for the healthcare worker themselves is what we will think. But when they are working 9 to 5 inside the hospital without much sunlight exposure in a gloomy environment, so that itself can cause many of the psychological issues. As a healthcare worker, we get involved with the patient care, and their treatment or whatever happens with the patient affects our psychological issues. Or workplace pressure itself will add to the psychological issues. So how can the psychological issues or the ergonomical hazards can lead to harm to oneself is like they go into low mood, low self-esteem, so depression, anxiety, irritability, so indirectly low work output and affecting their behavior, so they get emotional too quickly, so they will not be able to focus or inability to concentrate on the work. So how can the PMR team or the physical medicine rehab team help in these workplace induced injuries? So what we do is we do a detailed patient assessment. We identify the source which is causing all these injuries or stress, and we provide the proper services which are required. Services, when I tell, it can be medications, interventions or injections done by the physiatrist or the PMR specialist. It can be physical therapy or the occupational therapy, how they teach the proper ways of working, or how they help in reducing the pain by pain modalities or exercises. And also when it comes to psychological issues, how a psychologist can help in counseling, and we also plan how a staff can get back to their work. How can organization also help in reducing these hazards? When the organization, they conduct regular training programs to explain or to educate the staff about what injuries can happen and how they can prevent or get the adequate treatment. By having proper SOPs or the standard operating procedures when any such hazard exposure happens, what to do so that the staff knows how to which direction to go when anything happens, and also annual health checkups that they will help the staff to get, so that any thing which can be identified early and treated at the earliest. How can one also take care of their own self? That is the most important thing. Like, one has to take care of yourself. Like, you are the most important person in your own life, so you have to take care of yourself. So attend all the training programs that the organization is helping to organize. How can a staff also help themselves? That is also very important. So taking care of yourself is the strongest pillar in entire healthcare organization. So you have to take care of your proper posture, attend all the trainings that the organization is conducting, so that you realize what are the hazards and how you can prevent or get the treatment. And also, if you've come across any such hazard which can cause injury to anyone else, you report to your immediate manager or the concerned authority. That is how we can have as a team, we can help the safety at the workplace. So as a team, we have to work towards having a safe and healthy work environment. So I wish everyone a healthy and safe work environment. Thank you.